Well, good morning, everybody, and thank you for joining us at this very important webinar. My name is Roger Wong. I am a clinical professor in geriatric medicine, the executive associate dean in the Faculty of Medicine at the University of British Columbia, and I am so delighted to be joining you this morning as a special guest to talk about what can we do to actually try to stay at home for as long as we would like. Very important topic for all of us. In particular, sharing this with our colleagues and our folks who are living with Parkinson's disease, as well as their care partners. So what I've decided to do today is to actually have a dialogue with you. In this particular dialogue, I have prepared some material. I'm going to start off by talking about that, but I also very much would welcome you to joining us because it's a live stream, and therefore you can type in your questions and you can let us know your thoughts and your comments. And I'm here in the next 45 minutes or so to answer as many questions as you would like me to do so. So without further ado, I'm just going to get started by talking about a couple of things. I think for all of us, we all know that individuals living with Parkinson's disease, there are certain unique features of the situation, of the condition. Today, I'm not going to really go a lot into the medical symptoms or findings of Parkinson's per se, but I do want to draw your attention to the fact that some of the unique features of Parkinson's actually lend themselves to special strategies we can do in order to help ourselves to stay longer at home. I think I just want to give you a bit of a heads up. I'm going to talk about some strategies, things that all of us can do. All of us can do either for ourselves or for our care partners, our loved ones, as some of us are looking after folks who are living with Parkinson's disease. So we know that these would include families and friends and neighbors and so on, and obviously as a community and in our society at large. There are three really big categories of strategies that I want to share with you about. And these strategies, I think, are good not only for individuals living with Parkinson's disease, but for everybody. I think all of us are aging. Aging is a process that none of us could escape. Therefore, we may as well try to take note of what we can all do. So the categories of these strategies, I think I'll group them into three. The first category is very much about safety, and I'm going to talk a lot about that today as the title of this webinar actually includes the word safety. The second category is actually about activity, and activity is going to be about physical activity and brain or mental activity. I'm going to talk about that. And then the third category is about socialization. And this is basically our interaction with other people. So those are the three big categories of strategies that I want to talk about. Now, some of you may think, wow, this is like not really rocket science. This is something that a lot of us already know. And I would agree. And many of us actually do know about these concepts, but I would challenge you. The question is, how many of us are actually doing that? I think is easier said than done sometimes. So it is very helpful for us to think in terms of some specific examples of these categories. So I would start off by talking about safety. And I think one of the things that we all would like to do is to stay in our own home environment for as long as possible. And that makes sense because our own home is the place whereby we have really collected a lot of very sweet memories, and we know the people around us, whether it's families or neighbors or friends, and the community, sense of belonging. I would say, though, the first and most important thing for us to keep in mind in order to be able to stay at home for longer is to maintaining safety. So safety is the most important piece. Now, what am I talking about? Am I talking about safety in the neighborhood? Am I talking about safety in the home? And the answer really is a bit of both. So I would say, in particular for individuals living with Parkinson's disease, We all know that one of the things that we want to emphasize is function, what we can do, and in doing so, it's also about how safely can we carry out those functions. Allow me to share with you an example. We know that individuals with Parkinson's, for instance, are at high risk of falls. And we know that falls are actually the most common type of accidents that happen, in particular in seniors. And this is the case in Canada and around the world. And a fall can have really serious consequences. Sometimes people would say, well, it's just landing on the floor inadvertently. So what's the big deal about it? Well, the big deal is people can have injuries. It can involve soft tissues like muscles and bruises, aches, but also it can involve more serious consequences, such as a fractured bone, like a broken bone. The most serious consequence, actually, that we see is actually a hip fracture, a broken hip. This can have very serious consequences. A lot of times, people would say, well, so what's the big deal about that? Well, the big deal about it is we know, based on the literature and the evidence, that a broken hip is associated with a very high likelihood of disability afterwards. And in fact, the mortality or the death rate within a year of a broken hip is very, very high. And therefore, one of the first things that we talk about to be able to stay at home is what can we do to keep ourselves safe, in particular in preventing accidents such as falls. So I think this is kind of a first thing that I want to share with you this morning. Well, many of you may have heard about my TEDx talk. I actually was involved in a TEDx talk, and you can find it on YouTube video. Just Google and put my name, Roger Wong, and TEDx, and you'll see my talk, and I spoke about it. But let me give you some tailored pieces of information specifically for individuals living with Parkinson's. And what can we do to prevent falls? Well, I think the first thing that we need to think about is our home environment. We start from home. And I'll just walk you through. As you walk through the home, the different rooms and different settings, you see different things. So as you enter the door, many of us would know that we actually like to have pieces of rug around the home. And, loose rugs can really be a hazard. It can really be a hazard for falls because we can all trip on it. And one of the first things that I really advise people is to get rid of the loose rugs, the floor rugs. And I know that traditionally sometimes people want to hide things underneath the rug. Like, I don't know whether you're one of those who like to hide your keys, even though everybody knows where to find them now. But figure out another way of hiding your keys without imposing a risk or hazard for falling. Now, as you walk through the living room, many of us would, you might have thought about whether your flooring is it carpeted or is it hardwood, and does it make a difference? Well, it does make a difference. Carpeted flooring, as we know, can be very nice to keeping our feet warm. It is a little bit of a worry if your carpet flooring is very, very thick. So if you got very thick carpet, and if you do need to use a walking aid, like a walker with wheels, for instance, the walker can get stuck. And it itself, it makes it more difficult to navigate. So sometimes, in particular for individuals who need to use walking aids, such as walkers, we would suggest maybe they consider switching over to hardwood floor. Now, some of you may say, well, wait a minute, for hardwood floor, if I were to have a fall, what would happen? And the impact can be quite significant, and I would agree. So it is a bit of a balance. One of the things that we talk about is if you have hardwood floor, it is really important that you try to make sure that you wear footwear that is anti-slip, that you're not going to slip on the wood. Now, as you walk through the living rooms, many of us would know that the traditional living rooms typically have a lot of furniture, a lot of clutter, whether it is decorative table or like sofa table or coffee table. There are so many tables. Just beware that these tables sometimes can actually things that we're talking about is these tables, the decorative tables and pieces of furniture, in fact, can become a potential fall hazard. So as you're trying to remove clutter in terms of the furnishing within the home, think about removing any tables that are not really functionally providing a purpose. Some of them will look beautiful in the living room area, but in fact, they can be a hazard. Then you walk through the home, and some homes have stairs. Now, I think, needless to say, navigating stairs can be a real risky situation, in particular for individuals who are likely to fall. I think the only advice I have there is, if at all possible, try to locate the bedroom and bathroom anyways within the same kind of a lower level of a house if you're living in a house, or to make sure that they don't actually have to keep using stairs, or you don't have to keep on using stairs up and down, so that you're less likely to fall as you are navigating the stairs. Now, there's always the option of putting in a mechanical lift to move out the stairs, a stair lift. It is an option, but it does require a certain amount of space in the home and resources, obviously. Now, let's walk into the bathroom. Obviously, it is a very important part of the home because all of us spend time in there, not just for toileting purposes, but for bathing purposes and other purposes. I think if you go into the bathroom, for all of us as geriatrics doctors, we got very worried when we counsel people about the bathroom. In particular, I think what we see sometimes is the toilet seat. Where you say, okay, Dr. Wong, why are you talking about a toilet seat? I think the toilet seat sometimes, if it is too low, it is actually a risk of fall as someone is trying to sit onto the toilet. So we have raised toilet seats that you can get quite easily from equipment stores, and they're not too expensive. Putting on grab bars on the wall is really important. In the bathroom, if the design is a bathtub design, then getting a bath stool with a mat, actually that is anti-slippery, is really helpful. A handheld shower head is always helpful so that you can control things a little bit more easily. So what I'm trying to share with you really are things that may not be rocket science, as I said before, but are nonetheless very important and helpful. And just make sure that walking through your home with your loved ones provide you a chance to really safety-proof the house. Now, the other thing that I want to share with you is about technology, because there are a lot of new technology now that we can put in place, in particular in the home setting. And something that I spoke about quite a lot is, how do you use the Internet of Things? Some of you would have heard about IoT, or Internet of Things, which is a way of using the Internet to connect home devices and appliances. And in fact, you can do so with even remote access. So this becomes very, very helpful, in particular, if you are a care partner and your loved one, say living with Parkinson's disease, live distances apart. And this way, you actually have a way of reassuring the front door is locked at night, the appliances are switched off at night, and if someone is knocking the door and they don't know who it is, remotely, you can use through the camera setting, figure out who actually is pounding on the door. But there are other kind of technological devices that are quite helpful, in particular, wearable devices. I think many of us would know that there are wearable devices. They are there now, and these devices are things that will remind us to take pills and medicines. They will tell us how many steps we walk during the day, and I'm going to come back and talk about activity later on. But in fact, this day and age, the devices can also act as a lifeline kind of situation. So, for instance, if someone were to have a fall, some of these devices can pick up signals, and in fact, the signals, in fact, can sense that there is an impact with the floor, and therefore, just like any lifeline, it can emit a signal and send a signal to the loved ones or care partners or paramedics that someone, let's say, who's living alone has fallen, and for what can you do about that? So I guess all in all, safety is really important. I know that there's a lot of information, and I try to do it in such a way that is going to be quite easily digestible by you and your loved ones. I hope that is quite helpful. Just taking a look here, I see that we actually have, I don't think we have we don't have any questions so far. So this is all good. So maybe I can carry on and talk about the next big category, which is activity. So when we talk about activity, activity can actually help us stay home longer. And I'm talking about both physical activity and mental activity, brain activity. Now we know that there is actually good evidence in the literature that exercise or physical activity is good for our body, but it's also good for the brain. So let me give you an example. If you look at the recommendations, say in Canada, we say that everybody should have at least, on average, 150 minutes of physical activity or exercise every week. So if you divide it into 5 days, that's like 30 minutes a day, 5 days a week. It can be any activity that has what we call moderate exertion. So walking is fine, swimming is fine, golfing is okay, swimming is good, Tai Chi is good. Now, why would I talk about Tai Chi? Interestingly, in the medical literature, there are different types of exercise that are being looked into, and Tai Chi seems to be the type that is associated most with benefit. Now, as it turns out, any kind of exercise is good, but I think if you look at something like Tai Chi, I think it has a couple of interesting features. It promotes balance, and I know, and we know that is really important for individuals living with Parkinson's, for instance. And it also, the movement is not very sudden. It's very smooth and gentle, kind of gradual movement. So it's not kind of an explosive burst of energy that is required, even though I do recognize that there are some very extreme forms of that particular martial arts. So the other benefit, let's face it, people who practice Tai Chi as a form of exercise, they do so in groups. And therefore, it is a wonderful opportunity for some social activities. I'm going to come back and talk about the importance of socialization as well. Now, when we talk about mental activity, obviously, what are we talking about? Are we talking about doing Sudoku? Are we talking about doing crossword puzzles? It really can be anything. It can be playing bridge. It can be reading books. It can be singing. It can be anything. So what we are trying to say is use your brain. Now, we know that individuals with Parkinson's are not necessarily at risk for sure of developing what we call dementia, which is a condition of the brain when memory and other functions are affected. We do know, however, that some individuals with Parkinson's may develop dementia, and there are special types of dementia, things such as what we call Parkinsonian dementia, which has to do with a slowness in the thinking, so-called bradyphrenia in technical terms. But there's also a type called dementia with Lewy bodies, and it is someone with Parkinson's type of symptoms plus a progressive dementia. But what I'm trying to say is there can be some really simple brain activities that can help both move the brain, exercise the brain, but also help with socialization. So let me give you one example. There's something called reminiscent therapy. What a good example is like looking at old photo albums. So if you look at old photo albums, again, for individuals who are becoming more forgetful, maybe they do develop that subcategory of Parkinson's dementia. I think it is important that you think about, looking at your photo, who are those people? What are people doing at the time? When was the time? Where was it? Generate a conversation, a dialogue. So it is actually really important that it is an opportunity that we use to interact with individuals living with Parkinson's. You're not just going to throw them an old photo album or an iPad and say, have a good life and disappear. You're going to use that opportunity to generate that conversation. We know that Physical activity, as I mentioned before, that is good for the body is also good for the brain. So there's now evidence to suggest that exercise is actually important for brain health. Now, interestingly, if you think of the underlying reasons, it is not too surprising because one of the benefits of exercise, physical activity, is to promote the health of our blood vessels in the body overall. These blood vessels go to supply various parts of the body, not just the muscles, but the heart and the brain. So healthy blood vessels to the brain basically help to promote healthy brain. And therefore, it is something that we promote quite a bit, even in individuals. In fact, in particular with individuals with Parkinson's disease, we strongly recommend an exercise program. Now, this is something that I would recommend for you to talk to either your family doctor, who can offer some advice about the type of exercise, the duration of exercise, and the frequency of exercise. But I also strongly recommend talking to your friendly physical therapist. Your physios, that we very affectionately call them, can be very helpful in helping you to design a program that is best tailored to your own needs. Now, in my experience as a very seasoned geriatric specialist, one of the biggest challenges that I've seen over the years, in particular in individuals living with Parkinson's, when you talk to them about exercise program, it has to do with the safety of doing exercise because people become fearful of falling as they move. So it ties into the first bit that I spoke about safety. Safety obviously comes first, but having said that, not moving at all is not going to help with safety because we all know that at some point we have to make a move to move from a say sitting position to a standing position, or when you are getting up first thing in the morning to try to move from a lying position to a sitting position. And we know that these times can be very challenging, in particular for individuals living with Parkinson's, because the blood pressure response can be abnormal. There's a situation whereby we talk about the blood pressure actually dropping precipitously quite quickly as we try to stand up, say from sitting, or sit up from lying down first thing in the morning. This is called postural hypotension, or the more technical term is called orthostatic hypotension. All it means is that as we change our posture from a lying to sitting or sitting to standing position, our blood pressure, in particular the blood pressure in the brain, cannot equilibrate fast enough as gravity pulls the blood down. And therefore we tend to get dizzy and we tend to fall. So one of the things that talk about in individuals who have blood pressure related issues is really that exercise of trying to get the body used to the changing in position. And it's really important in particular. And this is something that we see quite often. And I'm just going to pause as we've been doing these. I've been trying to stick to time, and I'm seeing that I think we're doing okay so far. Okay. So maybe we will move on and talk about the third category of socialization. Just taking a sip of water first. Again, just to show you, this is a live stream. This is not pre-recorded. So let's talk about socialization. Now, many of us know that there is a relationship between how we feel emotionally and how we feel physically and mentally. Now, there is more evidence to actually suggest that socialization can be really important to our health. In fact, there was a recent study that actually showed that for individuals, and this is about any individuals, but in particular for individuals, say seniors, in particular, we know that social isolation or loneliness can be really problematic. It can have very negative health effects. In fact, one study would call kind of loneliness as a new cigarette smoking, because loneliness can be affecting our health in a negative way. is almost like smoking 15 cigarettes a day and cutting back our life expectancy for as long as 8 years. That's a big deal. So what we try to do, therefore, is to make sure that we overcome this loneliness and social isolation. And a good solution is the various ways of socialization. So one of the things that we talk about in socialization, what we're talking about is interacting with people, with individuals. It could be your family members, it could be your friends, it could be your neighbors, it could be folks from a local church groups that you go to, a community center, anybody. And again, what is important, we know, is that activities that you are used to doing, and whether you were always a bridge player, or you're someone who actually loves playing tennis, or you love going ballroom dancing with people, or you love golfing, try to make use of those opportunities first. So leverage on things that you have already been doing and try to build on those. Remember, individuals with Parkinson's, we encourage you to do all these things that you have always been doing. And in fact, we know that when you are trying to build on something that you're used to, it's going to come more naturally. And the most important thing is it's going to be more sustainable. So I spoke about technology a little while ago. So within the realm of socialization, technology can also help us. Interestingly, we know that there are many social media channels, for instance. Now, I'm not talking about just signing on to Facebook or to Skype, etc. Is going to automatically make you a social animal. That's not what I'm talking about. But we know that people have actually tried to study the effect of bringing in familiar faces during meal times. For instance, for individuals, seniors who live alone, we know that meal times traditionally is a very sociable time. And yet, without loved ones around, that experience can be quite different. So there are people who have studied by using iPads or tablet technologies, trying to beam in signals of family members who live distances apart during mealtime so that they can have a real FaceTime conversation during the meal. Now, obviously, it's not as good as the real person there. And something that I always talk about is technology is cool, but it cannot replace a real hug. You do need the real hug from time to time. So I guess in some ways, socialization is something that we as a community can do quite a bit about, because creating opportunities for socialization is what we're talking about now. I do know, for instance, for the Parkinson Society of BC, you have regular group meetings and you have activities, including physical exercise activity. I've been to some of your meetings before and fortunate enough to be speaking to your groups. And so I know that usually right before and after I speak, people would be getting up to exercise, and they do group activities, they have potlucks, and they have a lot of different things. I think that is so excellent. What I'm trying to say is at a community level, and in fact at the society level, there are things, decisions that we can make in order to promote socialization. It starts from an individual, but it goes to the community. So I guess with that, I'm just taking a quick look here. Oh, I see that we have some questions, actually. Maybe I'm just going to pause from my conversation about the three categories, and within the next minute move into some of these questions. But perhaps just let me say one more thing before going to the question is, when I talk about the three categories of things I've spoken with you today, this morning, and shared with you in terms of safety, in terms of activity, in terms of socialization, remember that they do not occur in isolation. They can all be put together as a package. And I think that's really important. I think that's the challenge for each and every one of us as we look through our own household, as we look through our own loved ones, families, and friends, and as we look at ourselves. Okay, with that, let's get to some questions. I see that we have a question, first of all, about can we get a prescription for exercise and use as a tax deduction. So the answer to the first part of the question is absolutely. Exercise prescriptions actually can be made available, and you can do it through your family doctor as well as talking to your physical therapist. I would say exercise can be used for tax deduction if it is a cost that is so. First disclaimer: I'm not an accountant. Having said that, I do have executive management training, so I have a business background. So I would try to answer that using my understanding. I think any cost that is incurred in seeking a physical therapist, for instance, that cost is potentially tax deductible because it is a bona fide expense to your health situation. If, however, your exercise prescription involves a very costly membership to a place of doing a particular type of exercise, I don't think that cost will be deductible. My advice is please talk to your accountant and your tax accountants who can actually answer the question. So I hope that we'll look after that question. I see another question is, how does geriatrician benefit people living with Parkinson? So I get asked that question a lot. Believe it or not, I still have people asking me, so Dr. Wong, you're a geriatrician. What do you do? So geriatricians are specialists who look after seniors. And as we know that many individuals living with Parkinson's, they either start off at a younger age, they live into the senior years, or they start off later on in life. So they start off having Parkinson's as a senior person. So how a geriatrician can help really is in a couple of ways. Number one, in geriatrics, we have an approach that is very holistic. We look at the whole person and we try to ask the question, what is the relationship between the health condition and the function of the person? The tool that we use technically is called Comprehensive Geriatric Assessment, or CGA. This particular approach is that holistic method of looking at the whole person and how we can correlate health conditions with functionality and what can we do to optimize functionality. In other words, we identify things that are potentially treatable and we treat the treatable conditions. And for things that are not necessarily curable, we still have a solution and an answer. And that is about optimizing quality of life and what we can do to help the person to function in their native environment for as long as possible, similar to what we are talking about today. So yeah, for those of you who know of someone who is an older person, for instance, who are living with Parkinson's, and if they have situations that we spoke about today, many of them may take many medications, many of them may be falling, many of them may have memory difficulty, they may have difficulty coping with the day-to-day activities of daily living. Those are the examples whereby a geriatrician can really help. And the way to access that is talk to your family doctor for a referral to a geriatric specialist. And I see there's another question. Should I stop seeing my GP to see a geriatrician instead? Well, the answer is absolutely not. Please don't stop seeing your family doctor. Your family doctor is really important as a quarterback. That's an analogy because coordination of care is so important. And in fact, we now in British Columbia, and many of you would know that in recent news, we are changing the way how we deliver primary care. And you would know that there are primary care teams of doctors working with nurses, in particular nurse practitioners, and with pharmacists, and with physical therapists. Oh, by the way, an occupational therapist. And let's not forget the importance of the OTs, whom we affectionately call them our occupational therapy colleagues. Occupational therapists can be very helpful in supporting you as you do your in-home check of that environment, that safety, in terms of installation of equipment and things to make your home safer. And also for those who actually have memory-related difficulty, the occupational therapist can be very helpful. So these primary care teams is really the way to go in the future, and the geriatrician is a member of that team. So I think Those are all the questions that I can see so far, I believe. Okay, and there's another one there. How might the geriatrician work with a neurologist to best support a patient with Parkinson's? This one is a very common scenario. So we know that neurologists who are specialists in brain health oftentimes are the first individuals who will make a definitive diagnosis of Parkinson's in individuals living with Parkinson's. In other words, the family doctor would have seen the issue and therefore made referral to the neurology specialist. Neurologist oftentimes is the first one to diagnose and starting treatment. A lot of times, a geriatrician like myself, actually, we work with a neurologist in particular in two areas. Number one is the area of function and functional optimization. So things that we spoke about today, for example, in terms of falls prevention. But another time that we work very closely is when there is a memory component, that dementia that I spoke about. And a lot of time the neurologist would refer to a geriatrician. Well, let me give you an example, a real example that I see quite regularly in my office practice at Vancouver General. So we have individuals who may be living with Parkinson's who actually have memory difficulty. Let's say they do have the dementia component. And one of the features of that difficulty could be wandering behavior. In other words, people don't know where they are and they become disoriented, and therefore they may leave their home in the middle of the night. You can imagine in this kind of weather, which is getting really cold now, that can be a real risk of hypothermia, low body temperature. So there are things that geriatricians can do in supporting these individuals, but most importantly, their families, their care partners, because it is very worrisome. So obviously, the first thing that we have to make sure in those situations is that is there anything fixable? In other words, is there an underlying condition that predisposes the person to having more of this wandering behavior? If, for instance, they're acutely more confused, a condition which technically we call delirium, and some of those things could be quite reversible. It will involve a review of all the medications taken, and geriatricians are very known to looking at the medication profile, the list of medicines, and deciding which of them are needed and which of them are not needed. So when there are medications that are not needed, because every medication can potentially carry a side effect, we will discontinue those medications. That is an approach called de-prescribing. So to remove the prescription is called de-prescribing. It's something that geriatricians do quite a bit. Now, obviously, I do not recommend family members or individuals living with Parkinson's just de-prescribe themselves because there can be real risk. So just be careful about that. But that's an example whereby a geriatrician will work with a neurologist in terms of optimizing function and managing the memory component. I see that as a question. What specialists would make up the best team for Parkinson's disease? You mentioned neurologist, geriatrician, OT physio. What about chiropractor, acupuncturist, or other specialties? Okay, so the examples that I provide are not meant to be exhaustive. They are examples that look at different categories. Obviously, a healthcare team would likely involve a lot of different individuals. Let me give you another example, as an example, not trying to be exhaustive. A registered massage therapist oftentimes can be very helpful in working with individuals living with Parkinson's. In particular, because we know that there's a lot of stiffness in the muscles affecting individuals with Parkinson's. So therefore, registered massage therapy can be a helpful way. And along the same line, acupuncture, we know that there are different techniques that are being used. I mean, I'm not a traditional Chinese medicine doctor, but I do know that there are many of my patients living with Parkinson's, they will swear by the benefit of having acupuncture. So I would say, therefore, indeed, as another question comes in, what about massage therapy? That's exactly what I'm talking about. So perfect timing, perfect timing. And I'm just checking in time-wise. I think we're doing okay with you. Okay, so we may have time for one more question or so before I turn into a pumpkin. Hopefully, I won't do that. We have a question. When should we, when should one consider moving or downsizing their home? This one is a good one. I think this is a very individual decision. What we're trying to promote is for all of us, including those living with Parkinson's, in particular with mild to moderate stages of Parkinson's, to be able to live at home and function for as long as possible. But there are going to be times when things get really, really tough. Let me give you some examples. In a situation when a person can actually cannot transfer or move at all. Now you would say, okay, there is the mechanical lift. You can always have a lift. Well, all right. And then you say, oh, wait a minute, you need two individuals to help the person get into a lift. Okay. But you start to see what I mean, like because it really builds up and it can be very, very difficult. Another situation will be when memory is really seriously affected to the point that the person can no longer recognize who their loved ones are. And this is something that is very, very sad because oftentimes the care partners, the families are the ones who have been working the hardest for the longest. And then the next thing you know, the person no longer recognizes them. It can be very heartbroken, I would say. And we get it. It's very, very tough. And then there's the final bit about safety. So when safety can no longer be maintained, let's say someone keeps falling. Now, wait a minute. At home, if they're going to fall, then even when you change the environment, they're still going to fall. But then the kind of work that care partners, families, and friends do instead of what we could say nursing care, which is very, very strenuous and is very stressful. That is the time when you need to start thinking about, maybe it is time to consider other living arrangements. I think in a lesser degree, in terms of downsizing home, it may not be as critical as the things that I spoke about. What I'll suggest is if you go back to the three categories of strategies that we talk about, and once again, they are safety, activity, and socialization, and you figure out your current home in terms of size and how convenient it is for you to be able to carry out those three types of strategies. Because a very big home, in fact, at a different stage of our life, it may not be the right fit for what we need to do. Just imagine, for instance, in terms of the safety aspect, to safety proof a big house is a very different matter compared to safety proofing a condominium or an apartment. So I encourage you to think about from a practicality and obviously personal preference point of view, think about what is the right time for you. I will say that across Canada, there are many individuals as they go through different stages of life, they ask themselves the same kind of questions. So you will not be alone by asking that particular. Thank you very much.